Guys, today we'll be starting about the lecture about the development of upper limbs, and then we'll be seeing about the different parts in the upper limb. Like we see about the osteology of upper limbs. We'll be seeing about the scapula bone, clavicle, humerus. Then we'll be seeing about the radius and the ulna and the wrist bones and the bones of fingers in the next week. Today we'll be limiting our session with about only up to humerus bone. Start with the development of upper limbs. Here we see this is you when you are in your mother's uterus. So this one is the upper limb bud. This upper limb bud develops at the end of the fourth week. We also have our lower limb buds. These are the lower limb buds. These lower limb buds developed by the end of the fifth week. We can see that the upper limb bud here, which is developing before the lower limb buds. These upper limb buds are developed from the somites of somites. These are derived from the paraxial mesodome. Both the upper limbs and both the upper and lower limb bones are derived from the somites, but the lower limbs are derived from the lateral mesodome, whereas the upper limbs are derived from the paraxial mesodome. Next, we will be seeing about the rotation of the upper limbs and lower limbs, how the after the development, how this is getting rotated to make the positions to actually how it is. So in the upper limbs, there is a 90-degree lateral rotation, which means the limbs which is going to be like this is going to rotate in this direction. And this limb will be rotating in this direction. This is how the upper limb is going to get rotated during its embryological development. This rotation makes the extensor compartment and the posterior compartment on its sides. In upper limbs we have the extensor compartment in the posterior side and the flexor compartment on the anterior side. So this is the anterior side. This side is going to have the flexor compartment, whereas behind this side we have the extensor compartment that is on the posterior side. So this is the necessity for the rotation to make the extensor compartment, posterior flexor compartment to its different sides. In the lower limbs, if you consider this as lower limbs, now we have the rotation same 90-degree, but this is going to be medial. This limb is going to rotate in this direction, and then this limb in this direction. So this is how this limb is going to get rotated, and making the lower limbs, the flexor compartment is going to be in the posterior side, whereas in the extensor compartment is going to be in the anterior side. So the next thing we'll be seeing about the upper limb is the dermatomes. These are known as dermatomes. Dermatome is a part of a skin which is going to be get supplied by the any spinal nerve. Which, like for example, we take a small piece of skin here. This is a skin here. If this skin is supplied from the spinal cord by the C5 fiber. I mean C5 dermatome. This is the C5 fiber from the spinal cord. This is supplying the skin here, so we call this as C5 dermatome. So this region is known as the C5 dermatome. You should know what is the basic thing about dermatome. So that's how we can continue further about this explanation about the which part of the upper limb is being supplied by the different which part of the dermatome. So we have our tip of our shoulder here. This tip of the shoulder is supplied by the C4 dermatome. We have here C4. We have the tip of the shoulder supplied by the C4 dermatome. So there is a very unique specialty that is making the tip of the shoulder. If you can guess, you can pause the video if you are watching, and then you can find it out again. Is it right or it is wrong? So the tip of the shoulder, it is supplied by the C4 dermatome. We also know that the phrenic nerve has a root value of from C3, C4, and C5 fibers. The major contribution is from the C4 fiber. The same C4 fiber is going to C4 dermatome, is supplying the tip of the shoulder. If there is any damage to the phrenic nerve, it is going to get affected in the tip of the shoulder here. we have a radiating pain towards the tip of the shoulder. That's why if there is a any damage to the phrenic nerve, we also have pain in the tip of the shoulder. So that is a this is a main point about diagnosing a patient. If there is a, generally they have a tip of the pain in the tip of the shoulder, we may think that is a shoulder pain, but it can be a phrenic nerve damage too. So that is why it is necessary to know the dermatome that is going to supply these areas. And next we will be seeing about the different areas of the upper limbs which is going to get supplied by the different dermatomes. The thumb region here, this is the thumb. This is going to get supplied by the thumb, the lateral part. This is the lateral parts here, the lateral parts of the forearm. These are the forearms, the lateral part of the forearm, and the thumb is going to get supplied by the C6 dermatome. As we see here, this is the C6 dermatome. The C6 part of the C6 card, this spinal nerve is going to get supply this region, so we call this a C6 dermatome. And the middle three fingers, we have middle three fingers here. These fingers are going to get supplied by the C7 dermatome. Then we have our little finger. This is the little finger, and we have our medial side here. These parts are going to get supplied by the C8 dermatome fiber. And we have a medial part of our arm. This is the arm, medial part of our arm. This medial part of our arm is going to get supplied by the T1 dermatome, whereas the lateral part of our arm is here, and this is going to get supplied by the C5 dermatome. As we see here, this area is supplied by the C5 dermatome. So only that much about development of upper limbs we need to know about while studying about anatomy. More details will be given to you in histology and in embryology. So next we will be seeing about our osteology of different parts of the upper limbs.